Hey folks, this is Dr. Hall with Desoto Upper Cervical. I wanted to talk to you today about phases of spinal degeneration. Now some people call it spinal degeneration, some doctors call it degenerative disc disease, some call it arthritis. But basically when the bones get out of position in your spine, what I mean by that, tilted one direction or the other, or even twisted one direction or the other, it puts an irregular pressure on the disc and causes the disc to wear out over time. And that's what we call spinal degeneration. Now in the neck, this is what it looks like in the neck. But just to give you a summary of this, when you're looking at the neck from the side, we should have a forward curve in the neck like this. The bone should look nice and square looking, and the disc spaces, which are in between the bones, should be nice, thick, and uniform throughout. Mid to lower back, we want to see nice and healthy looking bones with a nice and healthy looking disc and nice and healthy looking nerves come out of the spine. Now, when you have a car accident, fall, or sporting injury, you can immediately be knocked from a normal phase into phase one of the three phases of spinal degeneration. What happens in the neck during phase one is you'll see the neck straightens like this. It does not curved anymore. And when it straightens like this, it puts more pressure on the disc and starts causing the disc to get thinner and sometimes even bulge out to the sides, which can bulge next to the nerves, unfortunately. But you'll see the fibers in the disc start tearing and that middle part of the disc becomes inflamed and swollen. Now, usually when you see it in the phase one, like you see right here and right here, problems have been there for about 10 to 15 years. Now, if we don't get it corrected while it's in the phase one, it's unfortunately going to try to go to a phase two next. Phase two, you're going to notice the disc wear out a lot more because you can see the disc is definitely a lot thinner right through here. And then you see the bone spurs starting to come on the edge of the bone. So a lot more wear and tear and a lot of ugliness going on with the disc and the bones there. In the neck area, you'll see the disc starts thinning right here and you start getting the spurs on the edge of the bones. Now, if we don't get it corrected while there, because this takes about 25 to 30 years, if we don't get it corrected there, it's going to try to go to a phase three next. Phase three looks even worse because you can see the disc is just about gone at that point. Bone on bone and getting close to bone on nerve right there. And also you notice the bone spurs are really bad right there. And you'll see on the neck area right here, you'll see multiple bones occurring with that degeneration. Discs are pretty much almost gone. The bone spurs are really big. That's about a 30, 35-year-old problem right there. So to avoid this, get good chiropractic care. Come check us out at Desoto Upper Cervical. Our number is 662-393-4848.